Hi, my name is Rodney Elliot, and I'm here today to talk a little bit about my experience with Dr. Ty at the Basic Spine Institute. I've been a police officer for 24 years now, and during that period of time, I've had numerous instances where I've injured my lower back. And it got to the point where I had 3 herniated discs in my lower back and was having difficulty wearing the 30 pounds of gear all day that I had to wear. And it became more and more challenging getting in and out of the radio car and climbing over walls and getting involved in foot pursuits. My recovery time was taking a lot longer when I got injured or when things would happen on my back. So I had requested to get some physical training. My desire was to go back to a trainer and work on core strength and deal with the issue non-surgically. My human resources decided, workers' comp people decided that I should maybe try a chiropractor. And although I had tried chiropractic care previously and it didn't relieve the symptoms long-term, it was just very temporary, short-term relief. I went along with it and went to a chiropractor that the city referred me to. And during my visit there, one of the assistants or the aides that were preparing me, so to speak, for the chiropractor to do an adjustment had put me in a prone position on a table, lifted my hand above my head and forward of my head. He put my hand on his hip and then very quickly and sharply pushed down with both of his hands on my left shoulder, tearing the labrum in my left shoulder. And eventually, we learned, also herniated a disc in my neck. So immediately after the injury, I started having more and more severe pains in my shoulder. I had shooting pains going down at initially just my left arm, and then over a period of time, both my left and my right arm shooting down into my thumb, index finger, and middle finger. 4 months after the incident occurred at the chiropractor's office, I was being seen by an orthopedic surgeon who specializes in shoulder surgeries. And after a series of tests and going through the workers' comp system, I had a labral flap repair surgery. And they removed the labral flap that was torn by the chiropractor's aide and did a deburrment in the shoulder, cleaned it up a little bit. And it relieved quite a bit of the pain, but I was still having that sharp stabbing pain and the shooting pain that was going down into my index finger, middle finger, and thumb. And after a period of time, the orthopedic surgeon realized that there was something maybe neurologically happening and that I would need to go somewhere other than to his office, being he was specialized in orthopedic surgery. I was sent to a neurologist and had a nerve conduction study and found that I had a brachial root or a cervical spine impingement that was causing all of the problems and the pain that was now being felt both in my neck and shooting down both my arms. I requested to see a neurosurgeon and was referred to Dr. Ty actually by a few of my co-workers at the police department that I worked for, who were also patients of Dr. Ty's at the time. Asked workers' comp if I can have an appointment with Dr. Ty, taking the nerve conduction study and with the issues that I was having. I eventually got to see Dr. Ty, and he sent me for MRI of both my neck, my shoulder, and also my lumbar spine, which was my original injury that I had been requesting to be treated for. Well, the MRI came back showing that I in fact had a 3 to 4 millimeter impingement in my C5 cervical, in my cervical spine of my neck at the C5, putting pressure on the nerve root that feeds down both arms into the thumb, index finger, and middle finger. So we continued with treatment. We tried a little bit of therapy. We tried a cortisone injection. We tried medications, and nothing was working. It it wasn't able, those items or those treatments weren't able to stop the pain. And then we had discussed surgical procedures and looked at quite a few different ways of doing either a microdiscectomy, a fusion using various different devices. We finally, after me doing some research on my own of the devices that he had suggested and talking to Dr. Tai, we decided to do an anterior cervical fusion using a PEEK device, P-E-E-K, PEEK. And inside of the PEEK device, Dr. Tai decided to use some materials that are ground up cadaver bones with chemicals that stimulate the bone growth. I thought that it sounded like the best procedure, and we all agreed. And after having the surgical procedure approved by workers' comp, I came in to the hospital, and Dr. Tai performed the anterior cervical fusion with that PEEK device, making a small, approximately 1.5 inch incision in my neck, on the front of my neck, right in a fold line, so that when the surgical scar heals, it'll eventually just kind of disappear into the fold of my skin, my neck. After Dr. Tai performed the surgery, I woke up out of anesthesia in the intensive care unit at Chapman Medical Center. And once all the anesthesia wore off, and I realized that the procedure was done, I felt instant relief. Prior to the surgery, I was having very, very, very bad headaches that would last all day, all the time. The headaches were so severe, I felt like I was only working at 70 to 80% of my capacity. It was really difficult and challenging to think straight and be able to operate and function at work with the headaches that I had. The headaches were instantly gone. And the shooting pain the stabbing pain in my neck and shooting pain that I had felt down both arms was gone. I felt so good that first day in intensive care that they actually got me up and I walked twice. The second time I actually got up and was able to walk outside of the hospital and get a breath of fresh air. It was very nice. I spent one night in the intensive care unit of the hospital and was released the next day to go home, and was taking very little medication, very little pain medications. It was just a blessing that I'd finally found Dr. Tai and got that procedure done, and was now free of all the pain associated with that herniated disc in my neck, and the stabbing pain in my neck and shooting pain down both my arms. It was, again, just really a blessing.